All right, great. Hey everyone, if you're watching Now This, thanks for tuning in on a Friday night with us for a very important discussion with a special guest. We're super excited. My name is Versha Sharma. I am the senior correspondent for Now This, and I am thrilled to be joined by one of the people who's been a leading voice in addressing this crisis. It's Andy Slavitt. He is the former administrator of the Centers for Medicare and Medicaid Services under the Obama administration. He's got a long, illustrious career in public health care. So Andy, thank you so much for being with us today.
It's great to be here, and thanks for spending your Friday night doing this instead of being chased around by kids or whatever else you would be doing on the Friday night during a pandemic.
Exactly. Well, exactly. What else are we going to do? I think getting information out to people is sort of the best way we can make use of our time. So it's good.
It's a pretty sad state of affairs when I'm considered Friday night entertainment, don't you think?
I don't know. I think there are these fan clubs popping up around you and Dr. Fauci, rightly so. It's nice to see when competence is valued. But just to sort of get us started, can you give us a rundown on where we're at right now in the U.S.? What's the state of the pandemic?
Okay, and I may repeat things that you all know because your audience pays such great attention. But let's just start with a couple key facts. We have a novel virus, which means that none of us have immunity. It is highly contagious, meaning that compared to the flu, you can do very little and give this virus off to other people. Number three is that you often have it and don't know you've had it. 80% of people who get the virus don't know where they've gotten it from. As many as half the people remain asymptomatic. And given how contagious it is, if you have it and you infect the average number of people, which is 2.3 or so, that's called the R0. You guys may have heard of that or may have known that already. When that happens, if that repeats itself 10 times, just to give you a sense of how this grows, you will have affected 4,100 people within just after having that repeated itself 10 times. And if the fatality rate is about what people think it is, and in some countries it's 0.5, it's really hard to know. In some countries it's 0.5, and some it's 3, 4, or 5. But if it's 1%, that means that for each person who gets it and unknowingly affects the average number of people, about 40 people will die. And the people to whom this is lethal for are three types of people. People who are older, people who are sicker, they've got some immunity system issues or have chronic disease. And third are people that I'm most worried about right now, which are people that are perfectly healthy, but would show up at a hospital and there wouldn't be an ICU bed or a ventilator or a nurse or a doctor who could take care of them and who would otherwise lead a long life. That's why we're all asking ourselves to socially isolate, what we call hashtags stay home. And we can talk about that and how challenging that is and how to get through that. As a country, we are on the upswing right now. We're about to become the epicenter for the world. Right. Within our country, the pockets are different. New Orleans is the biggest hotspot in the world right now. It's the fastest growing place for coronavirus in the world. It's growing at 67% a day. And there's a bit of a lag time. So as people begin to obey these measures, we can begin to bring this virus under control, but it will take, a few weeks from when we start this in earnest before this thing becomes under control. So we're going to see some really disturbing images and numbers, the kinds of things we're really not used to in this country over the next a little while. There's just no getting around it. The best thing we could do is support our frontline healthcare workers, support them mostly by creating fewer cases, infecting fewer people, but also in any other way we can, babysitting, love, caring, etc. And this will be a tough effort for many of us, different than we've ever faced before, but we'll get through it.
So given your career, have you ever encountered anything like this before? I think it's rightly so. We're saying this is sort of like a scale that many of us have not seen in our lifetimes.
Right. Well, I'll say two things. First of all, um, this will, I don't think anybody alive, unless they were alive during the 1918 flu, had
Hmm.
seen anything like this, or unless they were in Africa during the Ebola crisis. Um, this is of a larger scale, but also from a traumatic standpoint, because it feels so uncertain to people. It feels like people felt after 9/11, except much even more uncertain than that. I would say there's another element of this, though, which is that I'm 53, even though I'm sure I look 25. But the
Exactly.
when you laugh, right? Or no, we go, yeah, maybe he does look 25, right? But I've never been um, asked to sacrifice in any significant way. My generation hasn't. Younger generations haven't. Even slightly older generations haven't. Um, like people did during World War II and at other times in our history. And you know that feels foreign to us too. We're used to and basically getting what we want when we want it. We're used to lots and lots of options. We're not used to the shelves being out of stuff. We're not used to not being able to go out. We're not used to being able to not see our friends. And all that feels like a tremendous burden. I have a feeling if we told people during earlier times that went through sacrifices that our sacrifice was to stay home with our family, um, they would say this is not quite such a big sacrifice. Now, I don't mean to minimize it because for the loss of income,
Mm.
the insecurity, the sense of lack of context, the anxiety, the inability to be comforted by the people in your life that you love, the fact that you can't watch your sports team or your entertainment show, all of those things are I'm not discounting any, they're hard, but also in hard times, great things can happen, and the support that we can give one another is even more important.
Yeah. There's a lot I want to dig into in terms of those numbers, especially in Louisiana, which I think is just starting to get a lot of attention, and rightly so. But before we kind of get into the details, from what you've seen so far, is social distancing working in the way that we want it to?
Absolutely, no question. The I have access to data which is real time. See, I just did a no. I just touched my face. You don't do that. You watch me.
It's good that you called it
I was
out, though.
trying to show you. Don't do that. Don't do that. The social distancing measures. If you look, we did a comparison of two counties, Santa Clara, California, and the other one was Miami-Dade County. Santa Clara, which put in place very intensive restrictions, closed bars and restaurants early. Miami-Dade, which I think is pretty well known at this time, didn't. And we graphed what happened after each action, and there were dramatic reductions in fevers, which are an early warning. And we looked at fevers compared to what they would normally be at this time of year. Now, that's great news. It shows that these things work. It's not visible to the naked eye.
Right.
Because we're used to the reinforcement of we do something positive, we get the reinforcement so we know it's working. Here, it's the opposite. If it's working, our healthcare system's not overrun, people aren't getting affected, the death toll's going down, and we tell ourselves, why are we doing this? But the reason those things are happening is because of you and the actions that you're taking for your community. And it is also important because right now, unfortunately, we just have a limited set of tools to use. If we were more prepared, like South Korea got itself more prepared, we would have other sets of tools. But right now, this is our number one tool, and maybe it's our number one, number two, and number three tool.
So we get a lot of questions from our audience, from people who just want clarification about self-quarantining for that 14-day period specifically. So if a person does that for 14 days and they're not showing any symptoms, does that mean they're just good to go, free roam around, stay 6 feet away from people still? But, what is the end of that 14 days?
Yeah, you should start licking surfaces and, getting real close to people. No, that's right. If you've gone through 14 days, you haven't had a test, So you don't know if you've had it. You don't know if you've had immunity. You still need to be careful, but you don't need to isolate. The number won't surprise you that people pass this most often along to people that they live with and their families.
Right.
The people I'm most concerned about are people who are living in close quarters, multi-generational households. If you live with a parent or a grandparent, you got to be extremely careful and cautious. People living in nursing homes, people living in low-income communities. So think about who you come in contact with. Recognize that even if you're past those 14 days, you're still, particularly if you're younger, you're highly likely to be asymptomatic if
Right.
you have it. So I wouldn't let my guard all the way down. I would keep track of who I was in contact with. I wouldn't go spend a lot of time with your grandparents or so forth yet. But yes, you can get yourself out of your room and you can go for a jog and all that stuff.
And if people are feeling sick, then they should still stay home, right? Like the first thing that they need to do is call their doctor or maybe even video chat their doctor. They don't need to go in as the first step.
That's right. There's a great new web portal out called While at Home that Jeray McKesson put together. On that, there's access to a free telemedicine video visit if you don't have that access yourself. So I think if you're just feeling feverish, a little feverish, not so bad, and you think you might have it, just assume you have it. It'll be like a viral flu. You'll go through it. It won't be pleasant, but it won't necessarily be terrible. I know a number of people who've been through it. If you're having trouble breathing, then you want to go to the hospital. But you really don't want to be in the ER or any place around a lot of people who potentially have it unless you absolutely need to be.
Right. I actually heard from a coworker who went to the pharmacy today to get, her own medicine. And she said the guy in front of her in line said he had it. And the pharmacist was like, you should go home. Like, what? Well, why are you here? But there are different ways that people are doing it. So Bill Gates said, I think it was last night, that he doesn't think the kind of state by state ad hoc shutdowns are working and that we need a national shutdown. What do you think of that?
I think Bill Gates is way smarter than me. So far be it for me to disagree with him. The only thing I'd say is it doesn't work when it's politically driven. Like I just got off a Instagram Live with Beto, and like in Texas, if they're not following the science and they're not self-isolating for political reasons, that's bad. But this is going to go through different parts of the country in waves in different parts of time. So if I were the federal government, I would put a strict set of rules in place for when it makes sense to do what. Because in Cleveland right now, many of their hospitals are a third full, and in New York, they're overflowing. Cleveland will get theirs, and New York will hopefully get past its peak. And so it would make all the sense in the world to share equipment, machinery, clinicians back and forth between these cities. And I don't think this is a hard subtlety, but if we were doing it right, you wouldn't tell people to self-quarantine a month and a half before it hit their community. So I think we have to count on a strict set of standards. And if we had health commissioners we relied on and governors that we could rely on, as we do in most states, we would be locking down and we would be being more aggressive. And I'm all for a national lockdown if we think it would work. The problem is I think there's parts of it that wouldn't work. And if I were the federal government and I felt like there was a state that wasn't following the proper scientific protocol, then I would overrule them. And that's a tough thing for people in our country to do. But so I'd say just maybe add a little bit of nuance to Bill, as opposed to hearing that as a disagreement.
That's something I think Governor Cuomo brought up in his press conference yesterday, which is that New York is expected to hit this apex, so-called apex first. And his suggestion is help us now. And when the apex comes to your state, we will help you and give you that equipment back, whatever we need now. So you feel like it's going to be sort of like this rolling basis in the United States?
Yeah, Southern Italy has not had isn't in nearly the situation that Northern Italy is, and
Right.
it's there, but there's people in Southern Italy that are, they're like, why'd you close my trattoria when, things are fine here? And, the truth is there is some hardship when you do it. But, it's hard to cut it too precisely. And because, I think part of Bill's point is because it's spreading via community, we don't have a good enough surveillance system, we don't have enough testing. You have to be conservative. Yeah, you can't wait. You have to go earlier than you think. And so as soon as there's any rise in community testing, it's right to do that. But yes, it's like fighting a war. We need to think of this logistically. Siri is just kicking my butt today that she's just talking for no reason.
That's fine.
Hang on a second, everybody.
Gotta plug devices
guess
in.
in the house would be Siri right now for some reason. Kind of creepy. So I think that we do a lot with logistics. We just launched a website today called Project N95/vents, and in concert with FEMA, and we're moving vents all around the country to where they need to be, so that we can do that. Hopefully, people will cooperate and support.
So you're working with just kind of like various private organizations and with FEMA to make that happen?
Yes, we've stood up things for Project N95 masks. We've set up things for that. We are working on testing. We've put out a 5-point policy plan for the federal government. We sent a set of recommendations and guidelines today to states. We are working on setting up pilots for what we call mini South Koreas. We're getting volunteers. We're doing a support system for frontline healthcare workers. So we're doing a lot of these things, and all of them are slightly different sets of we. They're different people who are volunteering and have good ideas, and I'm trying to help enable them, because that's how we're going to get through this. And it feels a lot better to contribute than feel helpless, right? Going through stuff like this, it's hard, but if you feel like you're doing something, it feels good. You get through it. It's a good way to cope with it. And then, when we look back on this, and the vast majority of us are going to be looking back on this at some point, we're going to ask ourselves, what were we doing? What did we do during this time? Did we help? And if it's as much as bringing a bowl of soup to an elderly neighbor, to anything else, this is a great time to build community and show compassion.
So I want to dig into the numbers that you mentioned a little bit earlier about the South. I think you said cases are growing faster in Louisiana than anywhere in the world, which seems, just like how did that happen? I understand people think Mardi Gras was probably part of it. Unfortunately, I think it was like over 1 million people come to New Orleans during Mardi Gras, and that was in February, sort of like at the height of this when we didn't know. So just, what is the data showing us about Louisiana? What should people know?
Yeah, Louisiana has a bad combination of factors. You start with Mardi Gras, which I think was probably the original sin. And then on top of that, you have a lot of low-income people, a lot of multi-generational households, a lot of people. The food down there is pretty good, the butter, the sugar. So you got a lot of people with diabetes, and you got a system that's been stressed by all of the other. So I think, I so worry for New Orleans, and they've been through crises before. So I think all of those factors, and then if you start late, the people who made the tough decisions early to start closing stuff down are the ones that are in the best shape. Gavin Newsom, I think, probably saved untold number of lives by acting quickly, and I think people felt at the time like, wow, this is extreme, but it turned out to be it'll be. I think history will show that it was quite prudent.
Yeah, and I'm a little worried about the surrounding states also from Louisiana, and I'm actually a Louisiana native, so this is very close to home. Literally, my family is still down there, but
Where
I
are they?
know that like central Louisiana, central and north, thankfully.
Baton
But
Rouge.
yeah, yeah,
Things
in
are
Alexandria,
okay. Things seem a little bit
yeah,
better over there. Yeah, right now.
yeah. But I have a lot of very good friends who live in New Orleans, and I know they're self quarantining, they're doing it, but they're obviously scared. I mean, it's a scary time.
Yeah.
And I know the Mississippi governor it seems to be one of the governors who is not taking this seriously, unfortunately, right? Exactly, that reaction. So just, what is your advice to people living in those states who might be watching right now?
A, don't elect an idiot.
Keep this in mind the next election, yes.
Right, right. Now you tell me, right? It's like the time to tell me that was before the election, but
Yes.
look, I have no idea like how or why this became partisan. These sorts of decisions. It's like certain people feel like the Democrats are just out to get Trump and spoil his economy. And look, I would say, like, I do have a certain amount of empathy. There's no right answers here. There's no winning. Every decision you make, whether you hurt the economy, you hurt people's lives, you hurt people's health, it's not easy. But listen to the scientists. Listen to. I mean, this is. So, I mean, I feel like, and I don't know the governor of Mississippi, but I feel like we're part of this is paying the price for kind of living in an anti-science, expert kind of moment in our history, and people are, God, people down there people are gonna pay the price for that more than they need to.
I think in New York now, I know Cuomo has said we've obviously ramped up testing as it should be, but the point that he's making is testing is not showing us the actual number of cases. It's just showing us that we're doing more testing and that people are kind of conflating the two. So what should people keep in mind about the stats that they're looking at right now?
Keep in mind that even though we're leading the world now in reported cases, the vast majority of our cases are unreported. So we
right.
have
so that number even higher.
Much higher. It's many more people are infected. And we've ramped up testing from about 10,000 tests a week to about 200,000 tests a week. So seeing in the numbers some catch up as opposed to just new infections. So I think the hashtag stay home movement is working better than we know. And so the numbers are depressing. And of course, there's a lag to hospital visits, and deaths. And so we're seeing what we're seeing now when we look at people hospitalized and we look at deaths are the things that happened a month ago when we were kind of more asleep at the wheel. So if we are on our game now, we'll start to see those numbers decline. I was on the phone with people in Seattle today, talking to someone in Seattle practically every day, and the curve is indeed starting to flatten. Now, they're not dropping. There's still new cases every day, but they're happening at a slower pace. So now they lived through this tragedy of almost 30 people dying in nursing home in Kirkland, and that's so they see it, they get it. I doubt there's a lot of people in Seattle who don't really understand what's going on and what's at stake here. And sadly, that tragedy occurred. But I think the more you get it, the more I think you see how effective it is to stay home, and the more people will comply with that.
Right. Right. And I think, you've made this point a couple times, but we probably can't make it enough, which is the number of asymptomatic carriers that are out there. So because there are so many asymptomatic carriers and we're still catching up testing wise, is it is it possible that we're just never going to know how many Americans actually had it from like December to March?
Yeah, in fact, there's some really interesting debates going on among scientists that some people believe we've had a lot more exposure with a lot more mild cases, and some people believe maybe a little bit of that, but not a ton. We know that there's been more. The way we'll learn is when we develop these antibody tests, which are already starting to roll out, which will test whether or not we're immune, which will be necessary for all of us to begin to take and get back. A bunch of us will find, hey, we were infected. We developed this antibody.
Right. I think you tweeted about one of those articles today. There was a New York Times piece about some experimental test that's going on with blood plasma. Could you explain that to our audience?
Well, so people who've had it, either people who die from it or who are just sick with it, they're trying to see if by taking the blood plasma from those people and putting it into healthy people, that creates an immunity. So that's something that they're testing.
Okay, so that's about finding possible natural immunity to it.
Scientists are going to be doing some amazing things if we just give them a chance.
Yeah.
If we just slow this thing down enough, scientists will help us catch up with this, with antivirals, with prophylactics, with vaccine, of course, with new ways of thinking about it, new antiviral drugs. So I have great confidence that the people in the thing we do, we talked about a lot of the things that we've kind of screwed up, but there's some things we're great at. There's things that are going to get us out of this. Yeah. If we give people a chance, we can do that.
Now, I think the talk was that a vaccine could be developed within the next 18 months, that it might take 18 months to do that. Do you feel like that's still a realistic timeline?
Yeah, so the reason that is, people ask, why not? Can it be rushed? Some of it can be rushed, but here's the thing. You don't want to develop a vaccine that you put in a couple 100 million people and find out 7 months later that you're killing people or making them worse, right? So it's not a matter of, the people who are developing these vaccines, they know what they're doing. It's not that they need 18 months to figure it out. It's they need to observe people.
Right.
And you got to get the dosage right, because you're giving it to older people, you're giving it to people kids, you're giving people way more, way less. You really want these things figured out. And then once you know that you got a working vaccine and you know those sorts of things, then it's going to take, and that could take about a year. You can then start to accelerate production, and these things take. Producing a vaccine isn't like running a photocopier, right? You may have a live vaccine. There's just a lot of stuff that makes that not so quick and straightforward. We gotta make it happen as quickly as humanly possible.
Yeah, the science takes time.
Science takes time, and remember, vaccines aren't perfect either, right? They're not going to be perfect for 100% of the population. And, there's an important case to be made that we're going to need to be careful with seniors and people who are at high risk on an ongoing basis, as this thing, even as it moderates, it's never gonna completely disappear. There'll be other strains of it. So we're going to need to learn to cope and live with it.
Now I think coping and living with it, that's exactly it. I saw a report that China has now reordered all of their cinemas to close, and there are a couple reports that we thought it was on the decline in Singapore and Taiwan, but we're seeing another spike. How do we think about the waves that might come? And I will let you go after this. I know you're tired.
Sorry, I did that.
That's okay.
I was yawning on behalf of the audience who had to listen to me. The waves are will be caused by a couple of things. I mean, if you could take a city and lock it down, not let anybody in or out, and keep people at home for some period of time, you get rid of the virus. The problem is when someone flies in from another city or another country, it activates the process all over again. So we live in a very connected world. We're going through now trying to figure out how to live in a world where we're connected in different ways. Um, and the and so I think people who like Singapore, Japan, Hong Kong, Wuhan, where they think they've gotten it beat, they learn that they really don't. So what does that mean? That means that you need really good testing and contact tracing in order to be able to track this thing. And we're going to need to be careful and learn a little bit of a new language. More and more of us will be immune. So those people who are immune will have, I think, it'll be obviously safer for them and their ability to move and go and interact. But you can't stop that. I mean, I'm sure most of the people watching this were on spring break in Florida at the beach doing all.
No, our audience is better than that.
No, come on. No, I'm kidding. But there's going to be we're only as good as our biggest idiot in some respects, right? Because there's always going to be like that kid who was, and I don't know if you saw the licking the stuff at the grocery store and stuff like that. So we're going to be more careful. I mean, I always kind of, I'm not a germaphobe. I always kind of looked at germaphobes as people who are like a little obsessive maybe. And not that I'm being judgy or anything, but I always kind of like what I think handshaking's done. Like I think 100 years from now, people are going to be like, wait a minute, when you saw someone, you used to like touch each other's hands. That's weird.
Right.
That's so dangerous. Why would you do that?
After touching our phones all day as well, which have so much bacteria on them. Absolutely. Yeah. Right. So we can't really say like realistically how long our lives are going to be like this. That's just something we have to kind of take week by week right now.
I think we're going to go through some phases.
Yeah.
I think Gates thinks that we're, in a phase, the social isolation phase, that we need to keep up 6 to 10 more weeks or so.
Okay.
Then I think if we do that well, we could be in a phase where if we've gotten better testing and contact tracing and so forth, we will be able to open up and careful monitoring, keeping distance, etc. We'll be in a phase where that can happen. We can do more new things, but just a little more carefully. And there'll be some of the waves. The summer will be better then because the virus doesn't like ultraviolet light. The fall will get a little worse, but it'll be different geographically. Hopefully by that time our health system will be prepared for people who are coming in. Right. The third phase is when we have a vaccine, and we'll begin to know that next year, and that will of course allow and more people kind of developing herd immunity, and then the fourth phase is just what we talked about a little bit earlier, the living with it, hey, it's going to happen seasonally. I've got vaccines. We've got different seasonality. We're going to want to keep people a little bit safer, and, life will go on, and then hopefully we'll be better prepared for the next pandemic. The only question is not, to me, will we get through this? The question is, how well will we get through this? How many people will we lose in the process? And I don't view this as a mission like to beat and defeat this thing. I view this as an every life saved. Everything we do that can help us save more lives, the history books will write this out better.
Yeah. Now you mentioned a couple resources earlier. Can we just direct our audience to what those are again, and we can certainly drop them in the comments as well so people can find them.
Well, let me start with some resources I didn't mention. So next week, April 1st, I'm actually launching a podcast that is called In the Bubble, that I'm doing with my family, like my kids.
Did we just get the scoop on this?
What's that? You
Did we just get the scoop on your podcast launch? That's great.
Yeah. So go to subscribe so I don't look like a total buffoon for launching a podcast. So everybody, I'll wait. Go subscribe. Go to Apple. Hit subscribe. It's called In the Bubble. There's a cute picture of me and my son in a bubble. I'm also newly on Instagram, thanks to my son. Which I still have no idea how it works. He's like, Dad, I got to take a picture of you. So it's Andy Slavitt. Those aren't the resources you were talking about. But it is all about me anyway, right?
We just need the information. Podcast sounds great.
What's that? The
podcast. We just need information, yeah.
We're gonna have it's gonna be really cool, family friendly, kind of upbeat but factual, and we got some really cool guests. There's a lot of things to get involved with. I think the portal for you while at home it's a good portal. It's gonna be getting even better. We've got something called Raise Your Hands COVID-19. Which is for people who want to volunteer at state and federal government where they need help. Right. We have a thing for frontline healthcare workers and helping them, which is going to be integrated into the While at Home platform. Then for getting vents to people and for masks and everything else, it's at www.project95.com. projectn95.com and projectn95/vents. So we will have all of that kind of and more good stuff will be coming. So great resources for you, but also great places for you to get involved and to help others and just keep yourself busy. What else do you have to do, right?
Right, exactly. I have to say I'm impressed with the sense of humor that you've managed to retain through all of this. And I think, we've talked about mental health is equally important right now. So as a final question, what are you doing to unwind? Is it a glass of wine at night? Is it binge watching some Netflix show? What are you doing?
A glass of red wine. Look, we shouldn't become alcoholics or drug abusers or anything out of this. And it's a serious point you're making. It's a really important point you're making here, which is, the anxiety people feel is natural. Yeah. And I think any therapist would tell you to acknowledge that anxiety and work through it and understand everything you're going through. You're not going through it alone. You're going through it with others. We're all going through this together. And lean on people, have people lean on you. Do not be in any way ashamed or embarrassed. And then the things that give you joy in life, if that's a glass of red wine, if it's binge watching Netflix, whatever it is, do it. Do it. I mean, enjoy, get those moments of joy in shut off the freaking news every once in a while. That's why our podcast is not going to be beating you over the head. Just like this conversation, life, so many elements of our lives should go on and even be richer. In my case, I've got my two sons home here with me. Sucks for them, but it's great for me. They're 21 and 18. I'm sure there's every place in the world they'd rather be, but they're stuck with their mom and me. And so I love that. They hang out with me. And as for the sense of humor, I mean, I did a podcast this week with Al Franken. I did one with Preet. But the one with Al, and I realize Al may be controversial to some folks, but so I don't mean to touch any third rails, but he's a funny person. We've known each other for years and years, and we make each other laugh a lot. And so he said, "Do you want to do a podcast?" And I said, "Sure, as long as we can just be us and make each other laugh." And it's amazing. There's funny stuff. you look at some of the memes going around. There's funny stuff, and if you can't laugh, or then you're just making it harder on yourself. So go ahead and laugh. It's how we deal with pain sometimes. It's totally appropriate.
Yeah, I think that's important, is people kind of feeling that permission and not feeling guilty that they might be enjoying themselves during such a time, but we need that. We all need that.
Totally.
All right. Will we be hearing maybe a former president on your podcast?
What's that?
I said, will we be hearing a former president on your podcast maybe?
I'll tell you what, I would love to have Michelle on. Not that I wouldn't love to have Barack on too, but I am having Chelsea Clinton on. She's already booked. But I think, part of the reason I would love to have Michelle on is her sensibility is so grounded. Her sense of balance, her sense of caring, she brings herself into the conversation in vulnerability about her daughters and life and so forth. So, like, if I had to choose, and I know Michelle is watching this, I would say, sorry, Barack. Like, I'd rather have Michelle on first, and then we'll get to you later. But I don't really have either one of them booked, unless it would make you subscribe. Then I will tell you that I have them booked.
Right. Perfect. I don't. Perfect. And if you are watching, the invitation at NowThis always open for any member of the Obama family or administration.
Right.
Andy,
I'd have the dogs on.
Yes, absolutely. I mean, I think pets are bringing people a lot of joy right now. Speaking of joy.
Yeah. Yes. Yeah, totally. Ours is, and those are great dogs.
All right. Any final words for our audience before we sign off?
First of all, like, if you're working in the healthcare field and you're a frontline healthcare worker, you're heroes, and I just would so much gratitude. I don't even know how to appreciate you. You're playing without a playbook. You're calling on reserve. If you didn't know you had. If you're not a frontline healthcare worker, thank every frontline healthcare worker you know. If you're staying in and sacrificing, I know it's hard, but thank you. You're actually saving lives. It's hard to imagine, but you're saving lives, which is pretty cool.
Yeah.
And and we'll get through this. We'll just get through this if we're there for each other and pay attention and so more. So thank you for having me on.
Thank you. Thank you so much for joining us. I will take this opportunity to thank my sister, who is a doctor in Louisiana. So thank you to Dr. J.M. McSharma. So
thank you. Thank you to her.
Thank you. Thank you so much for your time, Andy. We really appreciate it.
You got it.
All right. Go enjoy the rest of your Friday. Thank you.
Thanks.